Welcome to Don't Quit Quitting, brief contact intervention training for frontline healthcare and public health staff. Over the next half hour, we will discuss how you can make a significant impact to the health of your clients and patients through your day-to-day interactions by incorporating a few simple techniques. And it only takes a few minutes. There are different levels of intervention that you can incorporate into your daily practice. At minimum, by inquiring about smoking and vaping status and offering self-help materials, you can get people thinking about whether they are ready to try to make a quit attempt. This is one of the ways your clients will know that you care about the impact that smoking and vaping has on their health, and that you can direct them to more support when they are ready. Brief contact intervention includes going through the 3 A's of cessation counseling: ask, advise, and act. As a health professional, you are optimally positioned to deliver this type of intervention and influence positive health outcomes for your clients. We'll be talking about this in more detail throughout this presentation. Intensive counseling involves having more in-depth discussions and often repeated sessions with clients. If you are interested in incorporating intensive counseling into your practice, we will tell you where you can find additional training later in this presentation, where you can learn more and develop your skills.
Why is BCI important? Why should it be a priority for healthcare providers and public health professionals to encourage cessation? Why should individuals, many of whom may enjoy smoking and vaping, consider making a quit attempt? There are lots of reasons, so let's take a look at a few of them now. Let's start by taking a step back and looking at the big picture. For starters, smoking is a killer. Smoking kills 13,000 Ontarians every year, with people who smoke living an average of 11 and a half years less than those who don't. People who smoke miss more work due to illness, require hospitalization more frequently, and have longer hospital stays than people who do not smoke. And that costs all of us. The total direct cost to healthcare, combined with the indirect economic costs of smoking, totals around $7.5 billion annually. People who don't smoke are also affected. Secondhand smoke increases the risk of many health harms and is responsible for 800 deaths every year in Canada among people who do not smoke.
Smoking and vaping will cost you, in more ways than one. Talking to your clients about the financial impact of smoking may help motivate some people to quit or make a quit attempt. The cost of everything is increasing, and cigarettes are no exception. A person who smokes a pack a day will likely spend $5,000 or more a year on cigarettes. Smoking cessation interventions, such as nicotine patches, gum, lozenges, and medications, will likely cost about half of that. There are also lots of ways to get them at a reduced price or for free. We will discuss some of them later on in this presentation. Best of all, many people who quit smoking can go on to being free of nicotine altogether, which saves them even more, not to mention all the fantastic health benefits to quitting.
Quitting is clearly important, but why brief contact interventions with all clients? Why not just wait for people to ask for help? Because health equity is a key concept to all work in public health. Health equity occurs when all people have a fair chance at reaching their full health potential and are not disadvantaged by social, economic, and environmental conditions. The social determinants of health impact clients' smoking or vaping behavior, as well as their ability to quit. Some populations that are disproportionately impacted by smoking include Indigenous people, individuals with a mental illness, those living with a low income, people who identify as GLBTQ2S+. Some of these groups have less frequent interactions with the healthcare system, and when they do, they are often not asked about smoking or vaping. Why is this? The healthcare provider may feel that the individual has too much on their plate, or they are unlikely to be interested in quitting. But this is not necessarily the case. For example, studies involving patients recruited from psychiatric settings suggest that they are about as likely as the general population to want to quit smoking. That is why BCI should be implemented with all clients, regardless of our own preconceived ideas of a person's desire to quit. BCI can increase every client's chance of quitting and reaching their full health potential.
In order to help people achieve better health, it is useful to understand how the body is affected. Nicotine is the addictive chemical that is delivered by smoking and vaping. After inhaling, nicotine travels through the arterial system and to nicotine receptors in the brain. Addiction can occur very quickly, creating the dependence and cravings that drive people to want it over and over again. Smoking affects virtually every system in the human body. The resulting issues create a great deal of harm and suffering, as well as an incredible burden on public health and healthcare resources. Now it's time for some good news. When a person quits smoking, the benefits can be experienced almost immediately. 20 minutes after quitting, blood pressure improves and pulse rate returns to normal. After 72 hours, breathing gets easier and cravings start to lessen. Within a few weeks, energy levels increase and circulation begins to improve. Within months, coughing and wheezing disappear as the lungs start to self-clean. After 1 year of not smoking, risk of heart attack decreases by 50%. After 5 years smoke-free, risk of stroke is cut in half. And after 10 years, your risk of some serious health conditions is the same as someone who has never smoked.
And what about vaping? Compared to combustible cigarettes, e-cigarettes produce less chemicals and at lower levels. They are almost certainly less harmful, but they are not harmless. Vaping can have physiological effects on the respiratory and cardiovascular systems. There is conclusive evidence that in addition to nicotine, most e-cigarette products contain and emit numerous potentially toxic substances. Vaping can be responsible for health problems including coughing, shortness of breath and chest pain, increased risk of heart disease and asthma attacks, addiction and dependence, and changes in brain development in youth, such as lower impulse control and increased risk of future substance use, including smoking. There are also other likely risks to vaping, both short and long term, that are still unknown. Some people will try to switch from smoking to vaping to reduce their risk of harm, but most adults who vape also smoke. It's important to advise your clients that vaping can be a method of harm reduction only if they completely replace smoking with vaping. Dual use includes the risks of both smoking and vaping, which results in increased harm. Vaping may have the potential to help some people quit smoking, but it is not approved as a smoking cessation aid by Health Canada. As there is a high variability in products and devices, it is important to speak with a cessation clinician to create an individualized plan to quit smoking before attempting to use e-cigarettes as a cessation aid. Just like smoking, many people who vape want to quit. About 1/3 of people who vape reported an intention to quit vaping within the next 6 months. 22% of Canadians who vape and are 25 or older made at least one quit attempt in the past year. Many of the same strategies for quitting smoking can also be used when quitting vaping. Clinicians who regularly deliver intensive cessation counseling can access resources and training on calculating how much NRT, or nicotine replacement therapy like patch and gum, would be effective in assisting someone who is quitting vaping, much the same way it can help individuals quit smoking.
Many people say that they want to quit smoking or vaping, intend to quit, or have even made multiple quit attempts without lasting success. But quitting can be hard. Most people understand the harms and would like to be smoke or vape free, yet have been unable to quit. This is the power of addiction. We must remember that not only is nicotine an extremely addictive substance, but smoking and vaping can also become a very significant part of a person's life. It is woven into their routines and relationships. Everyone's quit journey is different, so support must be tailored to each individual. When it comes to smoking and vaping, there is a 3-link chain of nicotine dependence, and for the best chance of success, we must address all 3.
First, let's look at the biological factors. Smoking and vaping leads to a physical dependence on nicotine. When a person becomes addicted, nicotine literally changes the brain. Cigarettes are designed to deliver nicotine to the brain extremely quickly. There is almost instant gratification when a person smokes or vapes. The brain's pleasure center delivers a reward in a rush of chemicals. This is why people can become addicted very quickly, especially youth. A young person's brain continues to grow well into their 20s, and the developing brain is extra susceptible to changes in the pleasure pathways that result in addiction. Once a person is addicted to nicotine, their body sends out some clear signals when it wants more. Every person who smokes or vapes has experienced nicotine cravings. When someone quits, they may feel pretty bad until their body gets used to not having nicotine. This is called withdrawal. Nicotine withdrawal may not be the same for everyone. On the screen, you'll see some common withdrawal symptoms. Others may include anxiety, difficulty concentrating, restlessness, decreased heart rate, increased appetite. Nicotine withdrawal can be one of the reasons a person will start smoking or vaping again. Nicotine replacement therapy and cessation medications can help alleviate these uncomfortable feelings. We will discuss this further later on in the presentation. Smoking is often described as a bad habit, but this doesn't tell the full story. The psychological component of nicotine addiction develops from the repeated actions and associations developed by regular smokers. This results in smoking becoming an automatic behavior. An addiction to smoking or vaping is both the chemical dependence on nicotine as well as the deep-rooted behavioral and psychological factors that make quitting extremely difficult for many people. Consider this. Among people who smoke daily, it is a behavior that is repeated more frequently than almost anything else they do in their lives. A person who smokes 20 cigarettes in a day at 10 puffs per cigarette takes 200 puffs per day. That also includes the repetitive hand-to-mouth motion, the act of lighting the cigarette, and the routine of regular breaks. It all becomes deeply ingrained and very difficult to change. People often have lengthy smoking histories that go way back to when they started as youth. This addiction has been a part of them through many formative events, including relationships, significant milestones, the good times, the bad times. It is part of their identity, and it becomes difficult to imagine life without it. Smoking or vaping can also become a coping mechanism to manage stress or something to do when feeling bored, lonely, or angry. It may even be used to self-medicate mental illness. For all of these reasons, psychological factors must be considered and addressed when assisting with smoking or vaping cessation.
There are often certain stimuli that may make a person want to smoke. These are activities that people do while they smoke, and through force of habit, become physically and psychologically associated with the act of smoking. After a person quits, these activities frequently become reminders or triggers that can make them crave nicotine. Triggers can be different for everyone. On the screen, you will see some common triggers. Triggers can also be people, places, activities, or feelings that make a person want to smoke. It's important for people to recognize when, where, why, and with whom they smoke, so that they can work on ways to avoid smoking in these situations. Having a plan to deal with triggers will give the person quitting a better chance of being successful. Closely related to the psychological aspect of nicotine addiction is the socio-cultural factor. Smoking and vaping becomes a part of many daily activities and rituals. This contributes to the difficulty of breaking addiction. To many, the social aspect of smoking or vaping is what they find the most enjoyable. Taking smoke breaks at work, smoking and drinking while out of the bar, vaping in between classes with friends, family gatherings that includes rituals of sharing meals, conversations, and smoking together. There are also cultural connections with tobacco that can be traced back for centuries. With some individuals, these can sometimes become interwoven with the use of commercial tobacco. As you can see, breaking the addiction to smoking and vaping is far more complicated than simply overcoming the physical cravings. A deeper understanding and a multi-pronged approach to creating a quit plan is often needed.
So now we know the reasons that it can be hard to quit. But what can we do about it? Why can you, as someone who works in health, assist someone to quit? The short answer is that people are influenced by your advice. It is likely the person is already looking to you for guidance about their health, so you are in an optimal position to influence their behavior. Brief contact interventions can increase the number of people who attempt to quit, and the more attempts people make, the more likely they are to find lasting success. BCI can be delivered in 3 simple steps: ask, advise, and act. This is a modified approach from the RNAO Best Practice Guideline, the 5 A's. Both frameworks are effective ways of organizing components of cessation counseling to guide implementation in practice. We have selected the 3A approach for this training for ease of facilitation and implementation.
Brief contact intervention is quick and can usually be included as part of intake of clients or other regular interactions. Screening for smoking or vaping and providing cessation treatments should be seen as part of a standard of care. It enables health professionals and service providers to identify who smokes or vapes and facilitate access to effective interventions. Clients can opt out if they wish, but taking the 3A approach with each client will increase referrals to cessation services and quit attempts. Remember, quitting is quite often the best thing people can do to improve their health.
The first A is ask. Ask about smoking or vaping during every reasonable interaction. Being specific about the time frame in which they smoked or vaped will make it clear what is being asked of them. There is less chance of misinterpretation or loopholes. If you have regular interactions with the person, you can personalize the ask for their situation. Have you smoked in the last 30 days? Have you vaped at all, even a puff since the last time we spoke? How's your quit attempt going? When was the last time you had a cigarette? The next question on the form is about smoking and vaping status. Do you smoke or vape, or have you in the last month? The second A is advise. Advise the client in clear, non-judgmental terms that quitting is one of, if not the best single thing they can do to improve their overall health. Tailor the message so that it fits with their own personal circumstances, especially if they have already told you there is something that is important to them that could be affected by quitting. For example, in light of your recent COPD diagnosis, it is extremely important that you quit smoking. I can help you by referring you to quit supports. Or, we've been discussing your budgeting goals. Would quitting smoking be something you could consider? I can help by referring you to quit smoking supports. Or, I notice that you're having some discoloration in your teeth, which is caused by smoking. If you'd like to try to quit, I can help with that. Or, you mentioned that you're having a hard time concentrating in class. Vaping could definitely be a factor in this. Let's talk about some strategies to help you quit.
Making a quit attempt is only part of the battle. Quitting is hard, and without support, attempts are successful only 3 to 5% of the time. That's why the third A is act. By assisting clients in their quit attempt, you can greatly improve their chances of success. You can act by directing them to quit supports, whether online, by phone, or local in-person counseling. Assist them in accessing free or lower-cost nicotine replacement therapy or medications. Review options that can help them stay motivated to quit, such as contests or apps. Give them self-help materials, such as pamphlets or websites. Invite them to continue the discussion with you by setting a follow-up appointment. Asking your client to measure their readiness for quitting can help them sort out their motivations and feelings about quitting in general. Ask them how important it is to make a change right now and rate it on a scale of 1 to 10. Do the same for how confident they are feeling about the change. Discuss why they picked the numbers they did and what they and you could do to move a few numbers higher. This is a good way to encourage your client to articulate their feelings about quitting while identifying barriers and strategies to overcome them.
Acting can also include relapse prevention. Slipping up is frequently a part of the quit process. When slips and relapses are normalized, they can be used to learn where the client is struggling and how they might develop additional strategies to cope with cravings and other triggers. The stages of change is a model that can be adapted to quitting smoking or vaping. Quitting is not a single act, but a cycle through which individuals can move back and forth through stages. Let's go through the stages now. Pre-contemplation is when the person is not quite ready to think about quitting. Contemplation is the stage when they are considering making a quit attempt. During preparation, they are looking at strategies to help them quit. The action stage is when the person is making a quit attempt. The maintenance stage includes following a quit plan or strategies to stay smoke-free. This stage could include a slip, but not going back to regular smoking. If the person relapses, they have returned to a routine of regular smoking after a period of being smoke-free. Be prepared for how you can support clients at every stage of the process. It is especially important that they understand that a slip is not a fall. Mistakes will happen, but they can learn from them and adapt their strategies to prevent relapsing back into regular smoking or vaping.
Now that you are familiar with the 3 A's, let's look at a few pieces of advice that you can share with clients in making their quit attempt. These are some common tips that many people have found helpful when quitting smoking or vaping. Cravings can sometimes pop up without warning, and it may feel like nothing will make them go away other than picking up a cigarette or vape. But in reality, most cravings last only a few minutes. One of the best ways to get through them is by practicing the 4 Ds. Distract yourself. Instead of focusing on your cravings, find activities you enjoy. Walking, journaling, or engaging in another hobby will help distract you from thinking about smoking or vaping. Drink water. This can help with cravings, controlling appetite, flushing chemicals from the body, and keeping hands busy. Delay. Most withdrawal symptoms only last a few minutes. If you can put off craving for just a little while, it will usually go away on its own. For more intense cravings, consider short-acting NRT such as the gum, lozenge, inhaler, or mouth spray. Deep breathe. Help your body and mind relax by taking slow, deep, calming breaths. Take a break, breathe, and feel the stress and cravings fade away.
Quitting is a personal journey, but that doesn't mean it should be done alone. Letting people in on the process can increase a person's chances of success. Family and friends can lend support when the going gets tough. Finding a buddy to quit at the same time can help by sharing strategies, celebrating successes, and motivating each other to keep trying when one of them feels like throwing in the towel. Encourage clients to write down who is in their support network and to let those people know how they can help. Nicotine replacement therapy, or NRT, is one of the best tools available when it comes to quitting. We'll give a brief overview of available products so that you can have the knowledge to talk about options with clients. If your plans include more intensive counseling, in which you will take part in dispensing NRT, additional training is available that will go over specifics like possible side effects and dosage, including how to calculate the correct amount or strength of NRT for clients who want to quit vaping.
There are 2 types of NRT, long-acting and short-acting. The nicotine patch is a long-acting NRT. It can make the person quitting feel more comfortable by providing a slow, steady delivery of nicotine. Long-acting NRT can be used with short-acting NRT to help manage cravings. Short-acting NRT delivers a quick dose of nicotine to help get through cravings and withdrawal symptoms without smoking or vaping. There are a number of different kinds of short-acting NRT, including the nicotine gum, lozenge, inhaler, and mouth spray. It is important to always read the directions on each package carefully, as use can vary slightly from brand to brand. Ensuring proper use will maximize the effectiveness of the product.
There are prescription medications that have been approved by Health Canada that can help a person quit. These medications work best if they are taken as prescribed while also getting extra support along the way. There are two kinds of quit smoking medications that are known by a number of different brand names. Taking varenicline with other quit smoking supports can almost triple the chance of quitting smoking. It blocks the effect of nicotine on the brain, so smoking becomes less enjoyable. It is the most effective medication for quitting. Common names for varenicline include Champix and Chantix. Bupropion can double a person's chance of quitting smoking. It reduces cravings and withdrawal symptoms and is another effective option if varenicline isn't the right fit for the person quitting. It can also help with depression or alleviate symptoms of depression. Common names for bupropion include Zyban and Wellbutrin. A healthcare provider or pharmacist can help your client decide if these medications are right for them. Both are covered by the Ontario Drug Benefit Program for individuals who qualify. You can help your client manage everything they've learned about quitting by making a quit plan. A good plan should include a quit date, whether they will cut back gradually or quit all at once, how to avoid their triggers, and what they will do when they would usually smoke or vape. Quit plans can be adapted as new strategies are developed and the person finds out what worked best for them. You can download a template for a quit plan at don'tquitquitting.ca.
There are lots of in-person and online supports to direct your clients who want to quit smoking or vaping. A great place to get started is don'tquitquitting.ca. On this site, you can find many of the quit tips that we discussed throughout this presentation. Don't Quit Quitting is also a one-stop shop for other quit resources. On it, you can be directed to your local public health unit's smoking and vaping webpage or cessation services, as well as a list of other supports across Ontario, like websites, apps, contests, and options for accessing free NRT. Many services linked on the page are tailored for specific populations, such as youth, young adults, Indigenous people, and more. It is recommended that you take some time checking out the many different options available so that you can recommend the supports that best suit the needs of your client. Finally, Don't Quit Quitting also has a page for healthcare providers, where you can review much of the information that we went through during this presentation. There are also links to additional trainings for more intensive counseling, such as the TEACH program from the Center for Addiction and Mental Health. Everything you need to help your client quit can start at don'tquitquitting.ca. Thank you for taking the time to learn about brief contact interventions and how you can help your clients quit smoking and vaping. To learn more about cessation interventions, visit don'tquitquitting.ca or contact the tobacco and vaping program staff at your public health unit.